certainly does not mean that I'm against health care reform. All of us are for to be able to take care of pre-existing conditions and portability of insurance. I know there's a bill by Republican Senator Tom Coburn and others just reinforcing that. So a lot of times this debate gets framed wrong. We'll both agree there's a lot of misrepresentations that's been made in this health care bill. The one that all of us see in every speech that President Obama gives is that if you like your current insurance policy, you can keep it. Congressman Lopsack said the same thing at his town hall meeting. You've said the same thing here this afternoon. This is far from the truth, Congressman Braley. If you like it, you can keep it. And I'd like to give you an example. In my former business that I owned, we covered 70% of a full family health plan. That full family plan at $12,000, our 70% as the employer was $8,000 for the coverage. Now, under HR 3200, it says if I decided not to provide that coverage, I would be assessed an 8% fee on my payroll in lieu of that coverage. Well, my employees did not average over $50,000 per year. So 8% of this $50,000 is $4,000 per employee. So as an employer, am I going to continue covering my employees at a cost out of my pocket at $8,000 per year? Or am I going to dump that insurance and cover them under the government option at $4,000 per year? With 67 employees, I stood to gain more than $250,000 a year by dumping the insurance and forcing them onto the government plan. I've talked with a lot of businesses that mirror this same example. In fact, there's studies out that show 88 million Americans will lose their health insurance coverage that they like. My employees like this coverage. They'll lose the insurance coverage they like by this exact same scenario. So when President Obama repeats this, and you repeat it, that if you like your present health insurance plan, you can keep it. This is not even close to a truthful statement.
Good.
What do you tell these 67 employees?
Thank you, sir. Give the call.
The same thing I'm going to tell you is that read the House bill, because the House bill tells an employer that if you're going to provide coverage to your employees, you have the choice of either paying for it at specific percent limits of that employee's income. If it's single coverage, it's at 1% limit. If it's for family coverage, it's reduced. And the percentage for family coverage that's in the bill, I believe, is 64, 65% that you're required to pay for family coverage for your employees. So you as the employer have a choice whether that's in the best interest of your workforce, or if you prefer not to pay at that level because of some sort of income differential between the level of employees you cover, you can tell your entire workforce, I'm going to not provide coverage to you, but under the House bill, I'm going to pay $8,000 into the exchange. And you are wrong, sir, because that employee is not required to go with the public health insurance option. The beauty of the exchange is they have a choice. That employee can say, okay, my employer's not providing me with coverage. And so I'm going to go into the exchange and choose which one of these plans is right for me. It may be a private health insurance plan. It may be a public health insurance option. But no employee in the scenario you're describing is forced to take the public option. That's wrong. That's not in the bill. So I am here to tell you that employers are going to face similar challenges they do right now, because employers also want to have a productive workforce. And right now, there are plenty of private health insurance options that provide wildly different types of benefits. And some companies decide, I want to recruit the best quality of employee, I'm going to provide the best health care possible under a private health insurance plan. Other employers will say, I'm going to provide a much more limited plan that may only provide catastrophic coverage, or it has a very high deductible, and some employees say, I can't afford that. I'm not even going to take the insurance that you offer. So I disagree with your characterization that President Obama is misrepresenting what's in the bill. And but that's the beauty of a democracy, is you and I can read this bill and reach different conclusions about it, and that's okay. Because what I'm here to do is to talk about the work that I've done on this bill, and I disagree with your conclusion that employers and individuals aren't going to have more choices under this bill.
Well, executive, you have to